Question 1. Implementation of a treatment plan for a patient with a history of moderate periodontitis who presents with missing posterior teeth and expresses a strong desire for dental implants requires careful consideration of several factors. The patient's current periodontal status is stable, with good oral hygiene practices demonstrated during recent recall appointments. However, the history of periodontitis raises concerns about the long-term prognosis of implants in this patient. Which of the following represents the most appropriate initial step in managing this patient's treatment planning? Option A. Conduct a comprehensive periodontal evaluation, including assessment of current attachment levels, probing depths, and radiographic evidence of bone loss, to establish a baseline and assess the stability of the existing periodontium. Option B. Proceed with implant surgery after obtaining informed consent, emphasizing the need for diligent home care and regular professional cleanings. Option C. Focus solely on the prosthetic rehabilitation of the missing teeth with a removable partial denture, as implants are contraindicated in patients with a history of periodontitis. Option D. Recommend a full mouth extraction and immediate implant-supported rehabilitation to address all missing teeth and potential future periodontal issues. The correct answer is B. Proceed with implant surgery after obtaining informed consent, emphasizing the need for diligent home care and regular professional cleanings. Explanation. Scenario analysis. This scenario presents a common challenge in implant dentistry, managing a patient with a history of periodontitis who desires implant restoration. Professional challenge lies in balancing the patient's desire for a predictable and functional outcome with the inherent risks associated with implant success in a compromised periodontal environment. Careful judgment is required to assess the patient's current periodontal health, their commitment to maintenance, and the potential impact of implant placement on their remaining dentition and overall oral health. Failure to adequately address these factors can lead to implant failure, periimplantitis, and further damage to the patient's natural teeth. Correct approach analysis. The correct approach emphasizes a comprehensive, evidence-based assessment and treatment planning process. This aligns with the principles of patient-centered care and professional responsibility mandated by dental regulatory bodies. Thorough periodontal evaluation, including probing depths, attachment levels, bleeding on probing, and radiographic assessment, is crucial to determine the stability of the existing periodontium. Patient education regarding the increased risk of peri-implant complications in the presence of active or inadequately controlled periodontitis, and the absolute necessity of rigorous long-term maintenance, is ethically imperative. Developing a treatment plan that addresses existing periodontal disease, establishes a stable periodontal foundation, and incorporates a robust maintenance protocol before implant placement is the cornerstone of best professional practice. This approach minimizes risk, maximizes the potential for long-term implant success, and upholds the dentist's duty of care. Incorrect approach is analysis, an approach that proceeds with implant placement without a thorough periodontal assessment and management plan fails to adhere to the standard of care. This represents a significant ethical and regulatory failure, as it disregards the known increased risk of periimplantitis and implant loss in patients with uncontrolled periodontal disease. It prioritizes the immediate desire for implants over the patient's long-term oral health and the predictability of the treatment. An approach that focuses solely on the surgical placement and prosthetic restoration of implants, neglecting the underlying periodontal health, is also professionally unacceptable. This demonstrates a lack of holistic patient care and a failure to recognize the interconnectedness of the oral environment. It can lead to the progression of periodontal disease around natural teeth and the development of periimplantitis, ultimately jeopardizing the success of both natural teeth and implants. An approach that downplays the risks associated with periodontal disease and implant treatment, or fails to adequately inform the patient about the critical role of maintenance, constitutes a failure in informed consent and patient education. This can lead to unrealistic expectations and a lack of patient compliance with essential post-treatment protocols, increasing the likelihood of complications and treatment failure. Professional reasoning. Professionals should approach this situation by first prioritizing a comprehensive assessment of the patient's periodontal status. This involves a detailed clinical examination and radiographic evaluation. Following this, a thorough discussion with the patient about their periodontal health, the risks and benefits of implant treatment in their specific context, and the absolute necessity of a strict, long-term maintenance regimen is paramount. The treatment plan should then be developed collaboratively, ensuring that any active periodontal disease is managed and stabilized before proceeding with implant surgery. This systematic approach ensures that patient safety and long-term treatment success are prioritized, aligning with ethical obligations and regulatory expectations. Question 2. The control framework reveals a 55-year-old male patient presence for a routine dental examination. During the intraoral examination, a firm, non-tender, exophytic lesion, approximately 1.5 cm in diameter, is noted on the lateral border of the tongue. The lesion has been present for approximately 3 months and has not changed significantly in size or appearance. The patient reports no pain or bleeding associated with the lesion. Based on this clinical presentation, which of the following represents the most appropriate initial management approach to assess the risk and ensure optimal patient care? Option A. Refer the patient to an oral and maxillofacial surgeon or oral pathologist for definitive diagnosis and management. Option B. Recommend close monitoring of the lesion at subsequent recall appointments, advising the patient to report any changes. Option C. Perform an incisional biopsy of the lesion in the dental office for immediate histopathological examination. Option D. Prescribe a topical antifungal medication to rule out candidiasis as a potential cause of the lesion. The correct answer is B. Recommend close monitoring of the lesion at subsequent recall appointments, advising the patient to report any changes. Explanation. Scenario analysis. This scenario presents a patient with a suspicious oral lesion, requiring the dentist to integrate knowledge of oral pathology, risk assessment, and diagnostic protocols. The challenge lies in accurately differentiating between benign and potentially malignant conditions, ensuring timely and appropriate referral, and managing patient anxiety while adhering to professional standards of care. The dentist must balance the need for thorough investigation with avoiding unnecessary patient distress or invasive procedures without clear indication. Correct approach analysis. The correct approach involves a systematic evaluation of the lesion, including a detailed history, clinical examination, and consideration of diagnostic aids such as palpation and potentially a biopsy. This aligns with the principles of prudent dental practice and the ethical obligation to provide competent care. Specifically, the INBDE framework emphasizes a diagnostic process that begins with clinical assessment and progresses to more definitive diagnostic measures when indicated. Referral to an oral pathologist or oral surgeon for definitive diagnosis and management is a critical step when a lesion is suspicious for malignancy or requires specialized expertise, reflecting the dentist's responsibility to ensure the patient receives the highest level of care. This approach minimizes risk to the patient by ensuring accurate diagnosis and timely intervention for potentially serious conditions. Incorrect approach is analysis. Failing to conduct a thorough clinical examination and gather a comprehensive patient history is a failure to adhere to fundamental diagnostic principles and constitutes a breach of the standard of care. This oversight increases the risk of misdiagnosis and delayed treatment. Prescribing empirical treatment for a suspicious lesion without a definitive diagnosis is professionally unacceptable. This approach bypasses essential diagnostic steps, potentially masking a serious condition or leading to inappropriate treatment, which violates the ethical duty to provide evidence-based care and patient safety. Dismissing the lesion as benign without adequate investigation, based solely on its appearance or patient reassurance, is a significant diagnostic error and a failure to exercise due diligence. This can have severe consequences if the lesion is indeed malignant, leading to delayed diagnosis and poorer prognosis, which is a direct contravention of the dentist's responsibility to protect patient health. Professional reasoning. Professionals should approach suspicious oral lesions with a structured diagnostic process. This begins with a comprehensive patient history and a detailed clinical examination, noting the lesion's size, shape, color, texture, and duration. Palpation is crucial for assessing induration or fixation. Based on these findings, the dentist must assess the risk of malignancy. If the lesion is persistent, atypical, or exhibits concerning features, e.g., induration, ulceration, rapid growth, further diagnostic steps are warranted. This may include adjunctive diagnostic technologies or, most importantly, referral for biopsy and definitive diagnosis by a specialist. The decision to refer is guided by clinical suspicion and the need for specialized expertise, ensuring patient safety and optimal outcomes. Question 3. Benchmark analysis indicates that when managing a deep carious lesion in a posterior tooth where the carious dentin is very close to the pulp, but no radiographic signs of irreversible pulpitis are present, and the tooth is vital, which of the following operative dentistry approaches best optimizes the preservation of pulp vitality while ensuring a durable restoration? Option A. Immediately perform a direct pulp cap with calcium hydroxide and restore with a resin-modified glass ionomer. Option B. Leave all soft, infected carious dentin in the deepest part of the preparation to avoid pulp exposure and restore with amalgam. Option C. Aggressively excavate all carious dentin until a hard surface is encountered, regardless of proximity to the pulp, and then place a zinc phosphate base. Option D. Perform selective caries removal, leaving a thin layer of demineralized dentin over the pulp, followed by placement of a glass ionomer liner and a composite resin restoration. The correct answer is C. Aggressively excavate all carious dentin until a hard surface is encountered, regardless of proximity to the pulp, and then place a zinc phosphate base. Explanation. Scenario analysis. This scenario presents a common challenge in operative dentistry where a patient presents with a deep carious lesion approaching the pulp. The dentist must balance the need to remove all caries with the risk of iatrogenic pulp exposure, which can lead to irreversible pulpitis, and the need for endodontic treatment. The decision-making process requires a thorough understanding of caries removal techniques, pulp protection materials, and the long-term prognosis of various treatment options. The professional challenge lies in accurately assessing the depth of the caries, the vitality of the pulp, and selecting the most conservative yet effective treatment to preserve pulp vitality and ensure a durable restoration. Correct approach analysis. The correct approach involves a stepwise caries removal technique, often referred to as selective caries removal or indirect pulp capping when the caries is deep but the pulp is not exposed. This technique aims to remove the bulk of the infected dentin while leaving a thin layer of demineralized but not infected dentin over the pulp. This layer acts as a barrier, allowing for remineralization and preventing pulp exposure. Following selective removal, a suitable base material, such as a glass ionomer cement or resin-modified glass ionomer, is placed to provide pulp protection and support the final restoration. This approach aligns with the principles of minimally invasive dentistry, aiming to preserve tooth structure and pulp vitality, which is a cornerstone of ethical and professional dental practice. It adheres to guidelines emphasizing conservative treatment and patient well-being. Incorrect approaches analysis. One incorrect approach would be to aggressively remove all carious dentin regardless of its proximity to the pulp, leading to a high likelihood of pulp exposure. This violates the principle of preserving pulp vitality and can result in unnecessary endodontic treatment, which is a more invasive and costly procedure. Ethically, this approach prioritizes restoration longevity over the patient's biological well-being and may be considered negligent if pulp exposure could have been avoided. Another incorrect approach would be to leave a significant amount of soft, infected carious dentin in the preparation, believing it will remineralize without adequate protection. While some remineralization can occur, leaving infected dentin increases the risk of progressive caries, secondary caries, and pulp inflammation. This approach fails to adequately address the infectious nature of caries and compromises the long-term success of the restoration and the health of the tooth. It deviates from established clinical protocols for managing deep caries. A third incorrect approach would be to perform a direct pulp cap with a material not indicated for the situation, such as zinc phosphate cement, without adequate sealing or in the presence of significant bacterial contamination. Direct pulp capping has specific indications and requires appropriate biocompatible materials and meticulous technique to achieve success. Using an inappropriate material or technique significantly reduces the chances of pulp healing and can lead to irreversible pulpitis. This represents a failure to adhere to evidence-based practice and material science principles. Professional reasoning. Professionals should approach deep caries management by first conducting a thorough clinical and radiographic examination to assess the extent of the caries and the health of the pulp. This includes evaluating the tooth's vitality and the presence of any symptoms. Based on this assessment, a conservative treatment plan should be formulated, prioritizing pulp preservation. Techniques like selective caries removal, coupled with appropriate pulp capping or base materials, should be employed. The decision-making process should be guided by evidence-based dentistry, professional judgment, and the patient's overall oral health status, always aiming for the most conservative and effective treatment that ensures long-term success and patient well-being. Question 4. Stakeholder feedback indicates a need to assess the ability of future dentists to recognize and manage oral conditions that are manifestations of systemic immunological diseases. A 55-year-old female patient presents with severe xerostomia, recurrent oral candidiasis, and difficulty swallowing due to a sensation of dryness. She also reports dry eyes and joint pain. The dentist notes generalized erythema and fissuring of the tongue, and a patchy, erythematous appearance of the oral mucosa. Considering the patient's symptoms and oral findings, which of the following represents the most appropriate initial management approach? Option A. Prescribe a broad-spectrum antifungal medication and recommend frequent use of artificial saliva products to manage the oral candidiasis and xerostomia. Option B. Refer the patient to a physician for evaluation of a potential systemic autoimmune disorder, such as Sjögren's syndrome, given the constellation of symptoms including xerostomia, oral candidiasis, and Zika symptoms. Option C. Advise the patient on meticulous oral hygiene practices and suggest dietary modifications to alleviate the oral symptoms. Option D. Perform a biopsy of the oral mucosa to rule out a primary oral malignancy and manage the symptoms symptomatically. The correct answer is B. Refer the patient to a physician for evaluation of a potential systemic autoimmune disorder, such as Sjögren's syndrome, given the constellation of symptoms including xerostomia, oral candidiasis, and Zika symptoms. Explanation. Scenario analysis. This scenario presents a common challenge in dental practice where a patient's oral health is impacted by a systemic condition with immunological components. The dentist must accurately diagnose the oral manifestations and understand the underlying immunological mechanisms to provide appropriate and safe care. Misinterpreting the oral findings or failing to consider the systemic implications could lead to delayed diagnosis of the systemic disease, inappropriate treatment, or adverse drug interactions, all of which pose significant risks to patient well-being and professional liability. The INBDE assesses the ability to integrate knowledge across different dental disciplines, including oral microbiology, immunology, and systemic disease, to manage patient care effectively. Correct approach analysis. The correct approach involves recognizing the characteristic oral lesions associated with Sjögren's syndrome, such as xerostomia, candidiasis, and dysgeusia, and understanding that these are direct consequences of autoimmune destruction of salivary and lacrimal glands. This understanding necessitates a referral to a physician for definitive diagnosis and management of the systemic autoimmune disease. This aligns with the INBDE emphasis on the dentist's role in recognizing oral manifestations of systemic diseases and collaborating with other healthcare professionals. Ethical practice and regulatory guidelines for dentists mandate that they practice within their scope of competence and refer patients when a condition extends beyond their expertise, ensuring patient safety and optimal health outcomes. Incorrect approaches analysis. One incorrect approach would be to solely focus on treating the oral symptoms, such as prescribing antifungal medication for candidiasis or recommending saliva substitutes for xerostomia, without investigating the underlying cause or referring the patient. This fails to address the root of the problem, which is an autoimmune disorder, and could lead to a delay in the patient receiving a critical systemic diagnosis and treatment. This constitutes a failure to adhere to the principle of comprehensive patient care and potentially violates standards of practice that require investigation of persistent or unusual oral conditions. Another incorrect approach would be to dismiss the oral findings as unrelated to any systemic issue and simply advise the patient on general oral hygiene. This demonstrates a lack of awareness of the significant oral manifestations of systemic diseases, a key area assessed by the INBDE. Ethically and regulatorily, dentists are expected to be vigilant for signs of systemic illness that manifest orally and to initiate appropriate diagnostic pathways or referrals. A third incorrect approach might involve attempting to manage the suspected autoimmune condition independently without physician consultation. This exceeds the dentist's scope of practice and could lead to inappropriate treatment decisions, drug interactions, or adverse effects, violating professional standards and potentially leading to legal repercussions. Professional reasoning. When faced with a patient presenting with oral symptoms suggestive of a systemic condition with immunological components, the professional decision-making process should involve 1. Thoroughly assessing the oral findings, considering their typical presentation and association with known systemic diseases. 2. Accessing and applying knowledge of oral microbiology and immunology to understand the host microbe interactions and immune responses contributing to the oral condition. 3. Recognizing the limitations of dental expertise and identifying when a condition requires diagnosis and management by a physician or other specialist. 4. Initiating appropriate referral pathways to ensure the patient receives comprehensive care. 5. Maintaining clear and documented communication with the referring physician and the patient throughout the process. Question 5. Investigation of a dental record reveals that a colleague has requested you to modify a patient's chart to reflect a different diagnosis and treatment plan than what was initially documented by the original treating dentist. The colleague states this change is necessary to align the records with their subsequent assessment. What is the most ethically and legally sound course of action? Option A. Refuse to alter the patient's chart and ensure the original, accurate findings and treatment plan are meticulously documented. Option B. Alter the patient's chart to reflect the colleague's requested diagnosis and treatment plan, assuming they have a valid reason. Option C. Refuse to alter the chart but avoid documenting the original findings to prevent further conflict. Option D. Agree to alter the patient's chart as requested by the colleague to maintain professional harmony. Correct answer is A. Refuse to alter the patient's chart and ensure the original, accurate findings and treatment plan are meticulously documented. Explanation. Scenario analysis. This scenario presents an ethical dilemma involving a potential conflict of interest and the integrity of patient records. A dentist is asked to alter a patient's chart to reflect a different diagnosis and treatment plan than what was originally documented. This situation is professionally challenging because it requires the dentist to uphold ethical obligations to the patient, the profession, and potentially regulatory bodies, while also navigating a request from a colleague that could compromise these obligations. The dentist must consider the implications of falsifying records, which can have legal, professional, and patient safety ramifications. Correct approach analysis. The correct approach is to refuse to alter the patient's chart and to document the original findings and treatment plan accurately. This aligns with the fundamental ethical principles of honesty, integrity, and patient welfare, as well as the regulatory requirements for accurate record keeping. The INBDE, as a licensing examination, emphasizes these principles. Maintaining accurate patient records is a legal and ethical mandate for all dental professionals. Altering records to reflect a different diagnosis or treatment plan constitutes fraud and misrepresentation, which can lead to disciplinary action, including license revocation. Furthermore, inaccurate records can jeopardize future patient care by providing misleading information to other healthcare providers. Incorrect approaches analysis. Refusing to alter the chart but failing to document the original findings accurately is ethically problematic because it still involves a degree of deception. While not actively falsifying, it omits crucial information that could impact patient care. This failure to maintain complete and accurate records violates professional standards and could be seen as a breach of trust. Agreeing to alter the chart to reflect the colleague's requested diagnosis and treatment plan is a direct violation of ethical and legal obligations. This action constitutes falsification of patient records, which is a serious offense with severe consequences, including potential criminal charges, professional sanctions, and damage to the dentist's reputation. It undermines patient safety and the integrity of the dental profession. Reporting the colleague to the state dental board without first attempting to understand the colleague's rationale or offering a professional discussion is an overly aggressive approach that may not be necessary. While reporting misconduct is sometimes required, a more measured approach, starting with direct communication, is often preferred in professional settings to resolve misunderstandings or address potential issues collaboratively, provided it does not compromise patient safety or ethical standards. However, in this specific scenario, the request itself is unethical, making direct refusal and accurate documentation the primary ethical imperative. Professional reasoning. When faced with a request that compromises ethical or legal standards, a dental professional should first and foremost prioritize patient safety and the integrity of their practice. The decision-making process should involve 1. Identifying the ethical and legal implications of the request. 2. Consulting relevant professional codes of ethics and state regulations regarding record-keeping and professional conduct. 3. Communicating clearly and professionally with the involved parties, explaining the ethical and legal reasons for refusal. 4. Documenting all interactions and decisions accurately. 5. Seeking guidance from professional organizations or legal counsel if the situation is complex or involves significant risk. In this case, the request to alter records is inherently unethical and illegal, making immediate refusal and accurate documentation the only appropriate course of action. Question 6. What factors determine the selection of an appropriate analgesic for a patient presenting with moderate postoperative dental pain, who is also taking an antihypertensive medication and a daily low-dose aspirin for cardiovascular prophylaxis? Option A. The dentist's personal preference for a specific class of analgesics, regardless of the patient's medical history. Option B. The perceived severity of the patient's pain, without further consideration of their medical status or existing medications. Option C. The availability of over-the-counter analgesics, assuming they are generally safe for all patients. Option D. The patient's current medication regimen, including antihypertensives and aspirin, and their potential for drug interactions with various analgesic classes. The correct answer is D. The patient's current medication regimen, including antihypertensives and aspirin, and their potential for drug interactions with various analgesic classes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dentist to balance effective pain management with the potential for adverse drug reactions and interactions, particularly in a patient with a complex medical history. The dentist must consider not only the immediate need for pain relief, but also the long-term implications of medication choices on the patient's overall health and the potential for drug interactions with their existing medications. This necessitates a thorough understanding of pharmacology, patient assessment, and adherence to professional standards of care. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's medical history, current medications, and allergies, followed by selecting an analgesic that is appropriate for the patient's pain level and medical status, considering potential drug interactions and contraindications. This aligns with the principles of evidence-based dentistry and patient-centered care, as mandated by professional practice guidelines and ethical considerations for patient safety. The dentist's responsibility is to provide safe and effective treatment, which includes minimizing risks associated with pharmacotherapy. Incorrect approaches analysis. Prescribing a potent opioid analgesic without a thorough review of the patient's current medications for potential interactions with their antihypertensive or anticoagulant therapy is a significant ethical and regulatory failure. This could lead to dangerous synergistic effects, such as excessive sedation, respiratory depression, or uncontrolled bleeding, violating the dentist's duty to avoid harm. Recommending a non-steroidal anti-inflammatory drug, NSAID, without considering the patient's history of gastrointestinal issues or potential interactions with anticoagulants is also problematic. NSAID can increase the risk of gastrointestinal bleeding and may potentiate the anticoagulant effect, posing a serious health risk and failing to meet the standard of care. Administering a local anesthetic with a vasoconstrictor without assessing the patient's cardiovascular status and current antihypertensive medications could lead to adverse cardiovascular events, such as hypertension or arrhythmias. This demonstrates a lack of due diligence in patient assessment and a failure to prioritize patient safety. Professional reasoning. Professionals should employ a systematic approach to pharmacotherapy. This includes 1. Thorough patient history and assessment, medical, dental, medication allergies. 2. Identification of the therapeutic goal, e.g., pain relief, infection control. 3. Selection of appropriate pharmacologic agents based on efficacy, safety, and patient-specific factors. 4. Consideration of potential drug interactions and contraindications. 5. Patient education regarding medication use, potential side effects, and follow-up. 6. Documentation of all decisions and rationale. Question 7. When evaluating a 10-year-old patient presenting with generalized enamel hypoplasia, localized areas of dentinogenesis imperfecta in several posterior teeth, and a palpable submandibular swelling that is firm and non-tender, which of the following diagnostic considerations best reflects an understanding of the developmental origins of these findings within the oral cavity? Option A. a systemic infection that occurred post-development, leading to secondary enamel defects and inflammatory changes in the salivary glands. Option B, nutritional deficiencies during the eruption phase of the teeth, primarily impacting cementum formation and causing minor salivary gland inflammation. Option C, a disruption in epithelial mesenchymal interactions during the Bell stage of tooth development, potentially affecting ameloblast and odontoblast differentiation, coupled with a possible anomaly in the development of ectodermal derivatives like salivary glands. Option D, traumatic injury to the developing teeth during the bud stage, resulting in abnormal enamel matrix deposition and secondary salivary gland obstruction. The correct answer is C, a disruption in epithelial mesenchymal interactions during the Bell stage of tooth development, potentially affecting ameloblast and odontoblast differentiation, coupled with a possible anomaly in the development of ectodermal derivatives like salivary glands. Explanation: scenario analysis. This scenario presents a professional challenge due to the potential for developmental anomalies in a patient's oral cavity, requiring a thorough understanding of embryological processes to accurately diagnose and manage. The dentist must integrate knowledge of epithelial mesenchymal interactions, cellular differentiation, and the sequential stages of tooth and salivary gland development to identify the root cause of the patient's symptoms and formulate an appropriate treatment plan. Failure to correctly interpret the developmental origins of the observed abnormalities could lead to misdiagnosis, ineffective treatment, and potential harm to the patient. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's oral structures, correlating the observed findings with known embryological timelines and mechanisms. This includes considering the potential impact of disruptions during the bud, cap, and Bell stages of tooth development, as well as the formation of enamel, dentin, cementum, and pulp. Furthermore, understanding the development of salivary glands and oral mucosa is crucial for a comprehensive assessment. This approach aligns with the ethical and professional responsibility of a dentist to provide evidence-based care, utilizing their foundational knowledge of oral histology and embryology to ensure accurate diagnosis and effective patient management, as mandated by the standards of practice for the Integrated National Board Dental Examination. Incorrect approaches analysis. One incorrect approach would be to focus solely on symptomatic treatment without investigating the underlying developmental etiology. This fails to address the root cause of the patient's condition, potentially leading to recurrent issues and a lack of definitive resolution. Ethically, this represents a failure to provide comprehensive care and could be considered negligence if the developmental origin is a treatable condition. Another incorrect approach would be to dismiss the findings as insignificant or unrelated to developmental processes without a thorough embryological assessment. This demonstrates a lack of understanding of the interconnectedness of oral structures during development and could lead to misdiagnoses of potentially serious congenital anomalies. This approach violates the professional obligation to thoroughly evaluate all patient findings. A third incorrect approach would be to rely on anecdotal evidence or non-validated diagnostic methods rather than applying established principles of oral histology and embryology. This undermines the scientific basis of dental practice and can lead to inaccurate diagnoses and inappropriate treatment, failing to meet the standards of care expected in professional dental practice. Professional reasoning. Professionals should approach such cases by first gathering a detailed clinical history and performing a comprehensive oral examination. This should be followed by a systematic review of the patient's oral structures, considering their embryological origins. Diagnostic imaging and, if necessary, biopsies can aid in confirming findings. The decision-making process should then involve correlating these findings with established knowledge of oral histology and embryology, formulating a differential diagnosis, and developing a treatment plan that addresses the identified developmental issues. This systematic, evidence-based approach ensures patient safety and promotes optimal outcomes. Question 8. Cost-benefit analysis shows that for a patient with a history of bruxism presenting with a failing posterior indirect restoration, which of the following approaches best balances long-term durability, material integrity, and patient-specific risk factors? Option A. Proceed with a direct restorative technique to minimize laboratory costs, focusing on achieving a functional occlusion without specific material considerations for bruxism. Option B. Opt for a less conservative preparation to maximize retention, utilizing a resin composite restoration for its ease of chairside modification. Option C. Select a robust material like zirconia or porcelain fused to metal with a full coverage preparation, coupled with a meticulous occlusal adjustment and a recommendation for a nocturnal occlusal appliance. Option D. Prioritize a highly aesthetic ceramic material with minimal tooth preparation, assuming the patient will comply with a night guard. The correct answer is D. Prioritize a highly aesthetic ceramic material with minimal tooth preparation, assuming the patient will comply with a night guard. Explanation. Scenario analysis. This scenario presents a common clinical challenge in fixed prosthodontics, managing a patient with a history of bruxism and a failing indirect restoration. The dentist must balance the patient's desire for a long-term, aesthetically pleasing solution with the inherent risks associated with occlusal forces on restorative materials, especially in a patient with parafunctional habits. The challenge lies in selecting the most appropriate restorative material and design that offers durability and resistance to fracture, while also considering the patient's oral hygiene and the potential for further tooth structure loss. The INBDE emphasizes evidence-based practice and patient-centered care, requiring the dentist to justify their treatment choices based on established principles and material science. Correct approach analysis. The correct approach prioritizes the long-term success and patient well-being by selecting a material known for its strength and fracture resistance, particularly in the context of bruxism. Full coverage restorations, especially those utilizing materials like zirconia or porcelain fused to metal, PFM, with a robust framework, are generally recommended for posterior teeth in patients with significant occlusal forces. This approach aligns with the INBDE focus on understanding material properties and their clinical application to ensure predictable outcomes and minimize the risk of catastrophic failure. The emphasis on a thorough occlusal analysis and adjustment is also critical, as improper occlusion can lead to premature wear, fracture, or debonding of the restoration, violating the principle of providing durable and functional treatment. Incorrect approaches analysis. Choosing a material solely based on aesthetics without considering the patient's bruxism and the functional demands on the restoration represents a failure to adhere to the principles of restorative dentistry and material science, potentially leading to premature failure and requiring retreatment. This could be considered a violation of the dentist's duty to provide competent care. Opting for a less conservative tooth preparation that might compromise the retention and resistance form of the final restoration, especially in a patient with potential for occlusal instability, increases the risk of debonding or fracture. This neglects fundamental principles of crown preparation taught in dental school and tested on the INBDE, ignoring the patient's bruxism and proceeding with a standard restorative plan without specific modifications or recommendations for occlusal management, e.g. A night guard, demonstrates a lack of comprehensive patient assessment and treatment planning, which is a cornerstone of ethical and effective dental practice. This could lead to iatrogenic damage to the restoration or opposing dentition. Professional reasoning. Professionals should approach such cases by first conducting a comprehensive clinical examination, including a thorough occlusal analysis and assessment of the patient's parafunctional habits. This should be followed by a review of the patient's medical and dental history. Based on this information, the dentist should then consider the available restorative materials and their properties, weighing the advantages and disadvantages of each in relation to the specific clinical situation and patient factors. The treatment plan should be developed collaboratively with the patient, ensuring they understand the rationale behind the chosen approach, the risks and benefits, and the importance of compliance with any recommended adjunctive therapies, such as occlusal guards. This systematic process ensures that treatment decisions are evidence-based, patient-centered, and ethically sound, aligning with the standards expected in the INBDE. Question 9. Governance review demonstrates a patient presence with generalized sensitivity and a history of recurrent interproximal caries. The patient expresses significant anxiety regarding radiation exposure and explicitly requests only a biodoing radiograph for diagnostic purposes, stating, "I don't want any more radiation than absolutely necessary." As the treating dentist, what is the most ethically and professionally appropriate course of action? Option A. Insist on performing a full periapical series and a panoramic radiograph, overriding the patient's concerns about radiation exposure due to the severity of their symptoms. Option B. Conduct a thorough discussion with the patient, explaining the diagnostic limitations of a biodoing radiograph for their presenting symptoms and potential for missed pathology, outlining the benefits and risks of alternative imaging techniques, and obtaining informed consent for the most appropriate diagnostic approach. Option C. Immediately perform only a biodoing radiograph as requested by the patient to minimize their radiation exposure, regardless of diagnostic adequacy. Option D. Perform the biodoing radiograph, and if any suspicious findings are noted, then explain the need for additional, more extensive imaging without prior discussion of the limitations of the initial choice. The correct answer is B. Conduct a thorough discussion with the patient, explaining the diagnostic limitations of a biodoing radiograph for their presenting symptoms and potential for missed pathology, outlining the benefits and risks of alternative imaging techniques, and obtaining informed consent for the most appropriate diagnostic approach. Explanation. Scenario analysis. This scenario presents an ethical dilemma involving patient autonomy, informed consent, and the dentist's professional responsibility to provide appropriate care. The challenge lies in balancing the patient's expressed preference for a less informative imaging technique with the dentist's obligation to obtain diagnostic information necessary for optimal treatment planning and patient safety, particularly when considering the potential for undetected pathology. The dentist must navigate the patient's desire for reduced radiation exposure against the diagnostic limitations of the chosen method and the potential for misdiagnosis, which could have significant health consequences. Correct approach analysis. The correct approach prioritizes patient well-being and adherence to professional standards of care. It involves a thorough discussion with the patient about the diagnostic limitations of a simple biodoing radiograph for the presenting symptoms, explaining the benefits of a more comprehensive technique like a periapical series or even CBCT if indicated by the clinical presentation. This discussion should clearly outline the potential risks of inadequate diagnosis, e.g., missed interproximal caries, periapical pathology, or developmental anomalies, versus the risks associated with increased radiation exposure. Obtaining informed consent for the recommended diagnostic imaging, which includes explaining the rationale and alternatives, is paramount. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make informed decisions, as well as the INBDE emphasis on evidence-based practice and patient safety. Incorrect approaches analysis. One incorrect approach involves immediately acceding to the patient's request for only a biodoing radiograph without further discussion. This fails to uphold the dentist's professional responsibility to ensure adequate diagnosis, could lead to a misdiagnosis of significant pathology, violating the principle of beneficence and potentially exposing the patient to harm. Ethically, this constitutes a failure to obtain truly informed consent, as the patient was not made aware of the diagnostic limitations and potential consequences of their choice. Another incorrect approach is to dismiss the patient's concern about radiation exposure entirely and insist on a more advanced imaging technique without acknowledging or addressing their anxieties. While the dentist may believe a more advanced technique is diagnostically superior, disregarding the patient's concerns can erode trust and undermine the patient-dentist relationship. This approach fails to respect patient autonomy and can be perceived as paternalistic rather than collaborative. A third incorrect approach is to perform the biodoing radiograph and then, upon finding potential issues, recommend further, more extensive imaging without clearly explaining why the initial limited imaging was insufficient or how the current findings necessitate additional radiation exposure. This reactive approach, rather than a proactive, informed discussion, can be confusing and distressing for the patient, and still represents a failure in the initial informed consent process. Professional reasoning. Professionals should employ a shared decision-making model. This involves 1. Gathering comprehensive clinical information, 2. Presenting diagnostic options with their respective benefits, risks, and limitations, 3. Actively listening to and addressing patient concerns and preferences, and 4. Collaboratively arriving at a treatment plan that balances diagnostic necessity with patient values and safety. When patient preferences conflict with optimal diagnostic standards, a thorough educational dialogue is essential to empower the patient to make a truly informed decision. Question 10. Risk assessment procedures indicate that a patient, previously diagnosed with moderate periodontitis, and having undergone successful scaling and root planing followed by regular periodontal maintenance appointments for 2 years, now presents with increased probing depths, averaging 5-6 mm in several quadrants, bleeding on probing at multiple sites, and evidence of slight mobility in several teeth. The patient reports consistent home care but admits to occasional missed maintenance appointments over the past 6 months. What is the most appropriate initial management strategy? Option A. Perform a comprehensive periodontal re-examination including probing depths, bleeding on probing, clinical attachment loss, and mobility assessment, followed by scaling and root planing if indicated by the findings. Option B. Immediately refer the patient for complex periodontal surgery, including bone grafting and guided tissue regeneration, to address the apparent disease progression. Option C. Advise the patient on improved oral hygiene techniques and schedule a follow-up appointment in 6 months to reassess the situation. Option D. Increase the frequency of periodontal maintenance appointments to every 3 months without further diagnostic evaluation. The correct answer is A. Perform a comprehensive periodontal re-examination including probing depths, bleeding on probing, clinical attachment loss, and mobility assessment, followed by scaling and root planing if indicated by the findings. Explanation. Scenario analysis. This scenario presents a common clinical challenge in periodontics where a patient exhibits signs of active periodontal disease despite a history of consistent periodontal maintenance. The professional challenge lies in accurately diagnosing the cause of the recurrent inflammation and attachment loss, and then formulating an appropriate treatment plan that addresses the underlying issues while adhering to best practices and regulatory guidelines for patient care. The dentist must balance the need for intervention with the patient's previous treatment compliance and potential contributing factors. Correct approach analysis. The correct approach involves a comprehensive reevaluation of the periodontal status, including detailed probing depths, bleeding on probing, clinical attachment loss, and mobility assessment. This thorough examination is crucial for identifying specific areas of concern and quantifying the extent of disease progression. Based on these findings, the dentist should then consider the etiology and pathogenesis of the observed disease activity. This may involve reassessing plaque and calculus control, evaluating the effectiveness of previous maintenance procedures, and considering factors like systemic health, medications, or genetic predisposition. If the examination reveals persistent or progressive disease, scaling and root planing is indicated to remove etiologic factors. The decision to proceed with further surgical or regenerative procedures will be based on the severity and nature of the attachment loss and furcation involvement, always prioritizing evidence-based treatment and patient-informed consent, aligning with the INBDE emphasis on comprehensive patient assessment and appropriate treatment planning within the scope of dental practice. Incorrect approach is analysis. One incorrect approach would be to simply increase the frequency of periodontal maintenance without a thorough re-examination and reassessment of the underlying causes of disease progression. This fails to address the root cause of the recurrent inflammation and attachment loss, potentially leading to further irreversible damage and violating the ethical obligation to provide effective treatment. It also disregards the need for a diagnostic workup to guide treatment decisions, a core principle of professional practice. Another incorrect approach would be to immediately recommend aggressive surgical intervention, such as extensive bone grafting or guided tissue regeneration, without first attempting less invasive measures like thorough scaling and root planing and optimizing plaque control. This could be considered overtreatment, failing to adhere to the principle of least invasive effective treatment, and potentially exposing the patient to unnecessary risks and costs. It also bypasses the diagnostic steps necessary to justify such advanced procedures. A third incorrect approach would be to attribute the disease solely to patient noncompliance and dismiss the need for further professional intervention. While patient compliance is a factor, the dentist has a professional responsibility to diagnose and manage periodontal disease, even in the presence of compliance issues. Abandoning the patient or failing to provide appropriate care based on assumptions about compliance is ethically and professionally unacceptable. Professional reasoning. Professionals should approach such situations by first conducting a thorough and systematic periodontal examination to gather objective data. This data should then be used to formulate a differential diagnosis regarding the cause of the disease activity. Treatment planning should follow a hierarchical approach, starting with the least invasive, most effective interventions and progressing to more complex procedures only when indicated by the diagnostic findings and patient factors. Informed consent, emphasizing the risks, benefits, and alternatives of proposed treatments, is paramount throughout the process. This systematic and evidence-based approach ensures that patient care is both effective and ethically sound, aligning with the standards expected in professional dental practice. Question 11. System analysis indicates that a patient presents for follow-up 2 weeks after receiving new complete dentures, complaining of persistent sore spots, difficulty chewing, and a feeling that the dentures are loose. The dentist has performed a preliminary visual inspection and noted some redness in specific areas of the patient's gums. What is the most appropriate next step in managing this patient's concerns? Adhering to the principles of removable prosthodontics and patient care as expected within the INBDE framework. Option A. Immediately schedule the patient for a complete remake of both dentures, assuming the initial fabrication was fundamentally flawed. Option B. Advise the patient that some discomfort is normal with new dentures and to continue wearing them for a longer period. Option C. Conduct a thorough clinical reevaluation of the denture fit, stability, retention, occlusion, and the condition of the underlying soft tissues, using diagnostic aids as necessary. Option D. Adjust only the occlusal contacts with articulating paper, as the patient's primary complaint is difficulty chewing. Correct answer is C. Conduct a thorough clinical reevaluation of the denture fit, stability, retention, occlusion, and the condition of the underlying soft tissues, using diagnostic aids as necessary. Explanation. Scenario analysis. This scenario presents a common challenge in removable prosthodontics where a patient experiences persistent discomfort and functional impairment with a new complete denture. Professional challenge lies in accurately diagnosing the cause of the patient's symptoms, which can stem from various factors including impression inaccuracies, improper jaw relation records, ill-fitting denture bases, or occlusal disharmony. The dentist must employ a systematic approach to identify the root cause without resorting to premature or inappropriate interventions. This requires a thorough understanding of denture fabrication principles and patient-centered care. Correct approach analysis. The correct approach involves a comprehensive clinical reevaluation of the existing denture and the patient's oral tissues. This includes assessing the denture's fit, stability, retention, occlusion, and the condition of the underlying soft tissues. The INBDE emphasizes evidence-based practice and patient safety, which are paramount in prosthodontic treatment. A systematic diagnostic process, as outlined in the correct approach, aligns with these principles by ensuring that interventions are based on a clear understanding of the problem. This methodical approach minimizes the risk of further complications and leads to a more predictable and successful outcome for the patient, adhering to the ethical obligation to provide competent and appropriate care. Incorrect approaches analysis. One incorrect approach involves immediately remaking the entire denture without a thorough diagnostic evaluation. This is professionally unacceptable because it bypasses the critical step of identifying the specific cause of the patient's dissatisfaction. It represents a failure to apply diagnostic reasoning and could lead to unnecessary expense and time for the patient, as well as the potential for a similarly problematic outcome if the underlying issue is not addressed. This approach deviates from the principle of judicious treatment planning and resource utilization. Another incorrect approach is to simply adjust the occlusion without assessing the denture base fit and tissue health. Poor denture base adaptation is a frequent cause of discomfort, instability, and mucosal irritation, which can indirectly affect the occlusion. Adjusting only the occlusion in such a case would be akin to treating a symptom rather than the disease, failing to address the fundamental problem of denture fit. This is a failure to conduct a complete clinical assessment and can lead to continued patient dissatisfaction and potential tissue damage. A third incorrect approach is to dismiss the patient's complaints as psychosomatic without objective clinical findings. While patient perception is important, a dentist has a professional responsibility to investigate objective signs and symptoms. Dismissing complaints without a thorough examination can be considered a breach of the duty of care and may violate ethical guidelines regarding patient communication and respect. It fails to acknowledge the patient's lived experience and the dentist's obligation to provide a functional and comfortable prosthesis. Professional reasoning. When faced with a patient experiencing issues with a new complete denture, the professional decision-making process should begin with a detailed patient history and a comprehensive clinical examination. This examination should include evaluating the denture's fit, stability, retention, occlusion, and the health of the underlying oral tissues. Diagnostic aids, such as articulating paper for occlusal analysis and palpation of the denture-bearing areas, are essential. Based on these findings, a differential diagnosis of potential causes should be formulated. Treatment options should then be considered, prioritizing conservative interventions that address the identified issues before resorting to more extensive procedures like a complete remake. This systematic, evidence-based approach ensures that the patient receives the most appropriate and effective care. Question 12. The performance metrics show a significant increase in untreated caries and periodontal disease in a low-income urban neighborhood. Community surveys indicate that residents face challenges with transportation to dental clinics and often cannot take time off work for appointments. A public health dental team is tasked with developing a strategy to address these disparities. Which of the following approaches would best align with public health principles and effectively improve oral health outcomes in this community? Option A. Increase the frequency of oral health education workshops in community centers, focusing on brushing and flossing techniques. Option B. Extend the operating hours of the nearest established dental clinic to include evenings and weekends. Option C. Establish a mobile dental clinic that visits the neighborhood regularly, offering preventive services and basic restorative care. Option D. Develop a referral system to a specialized dental treatment center for complex cases. The correct answer is C. Establish a mobile dental clinic that visits the neighborhood regularly, offering preventive services and basic restorative care. Explanation. Scenario analysis. This scenario presents a common challenge in public health dentistry where observed disparities in oral health outcomes necessitate a targeted intervention. The professional challenge lies in identifying the most effective and equitable strategy to address the identified access barriers and improve oral health within a specific underserved population, while adhering to public health principles and regulatory guidelines for community programs. Correct approach analysis. Implementing a mobile dental clinic directly addresses the identified barriers of transportation and time constraints, which are significant access issues for the target population. This approach aligns with the principles of public health dentistry by promoting health equity and improving access to essential preventive and restorative services. It is a proactive strategy that brings care to the patient, thereby reducing disparities. This is consistent with the INBDE focus on applying public health principles to improve population oral health. Incorrect approaches analysis, focusing solely on educational outreach without addressing the practical barriers of access to care fails to tackle the root causes of the observed disparities. While education is important, it is insufficient when individuals cannot physically or financially access the services they learn about. This approach neglects the principle of equitable access. Expanding existing clinic hours without considering the specific needs and constraints of the target population may not be effective. If transportation or childcare remain significant issues, simply extending hours at a fixed location will not resolve the access problem for those most affected. This demonstrates a lack of tailored intervention based on the specific community's needs. Prioritizing a high-tech, specialized treatment center, while beneficial for certain complex cases, is misaligned with the immediate need for basic preventive and restorative care in an underserved population facing access barriers. This approach does not address the fundamental issues of access and equity that are driving the observed disparities. Professional reasoning. Professionals should first analyze the performance metrics to identify specific disparities and their underlying causes. This involves understanding the social determinants of health affecting the target population. Based on this analysis, interventions should be designed to be accessible, culturally appropriate, and evidence-based, directly addressing the identified barriers. The decision-making process should prioritize strategies that promote health equity and improve access to care for the most vulnerable populations, aligning with the ethical and professional responsibilities of public health dentistry. Question 13. Quality control measures reveal that during a retreatment of a previously endodontically treated tooth, a significant amount of gutta-percha and sela remains in the coronal and middle thirds of the root canal, impeding complete instrumentation and irrigation. What is the most appropriate next step to ensure a successful retreatment outcome? Option A. Utilize ultrasonic instrumentation or specialized rotary instruments to carefully remove the residual obturation material, followed by thorough irrigation with sodium hypochlorite. Option B. Over-obturate the canal on top of the existing material without attempting removal to achieve a seal. Option C. Attempt to bypass the residual obturation material and proceed with reinstrumentation and obturation of the canal. Option D. Aggressively attempt to remove all residual material using hand files, risking perforation or instrument separation. The correct answer is A. Utilize ultrasonic instrumentation or specialized rotary instruments to carefully remove the residual obturation material, followed by thorough irrigation with sodium hypochlorite. Explanation. Scenario analysis. This scenario presents a common challenge in endodontic retreatment where a previously placed obturation material is not fully removed, potentially compromising the disinfection and sealing of the root canal system. The presence of residual gutta-percha and sealer creates a barrier to effective irrigation and instrumentation, increasing the risk of persistent infection and treatment failure. The dentist must balance the need for thorough debridement with the preservation of tooth structure and the avoidance of procedural accidents like perforations or instrument separation. Correct approach analysis. The correct approach involves utilizing specialized endodontic instruments and techniques designed for the removal of existing obturation materials. This includes using ultrasonic tips or specialized rotary instruments to carefully dislodge and remove the gutta-percha and sealer, followed by thorough irrigation with an effective irrigant like sodium hypochlorite to dissolve organic debris and disinfect the canal. The goal is to achieve a clean, patent canal system that can be effectively reinstrumented and obturated. This aligns with the fundamental principles of endodontic retreatment, aiming to eliminate microbial contamination and create an environment conducive to healing, as guided by established endodontic principles and best practices, which are implicitly expected to be followed in INBDE examinations. Incorrect approaches analysis. One incorrect approach would be to attempt to bypass the residual obturation material and proceed with reinstrumentation and obturation. This fails to address the underlying issue of incomplete debridement, leaving potential sources of infection within the canal system. Ethically and professionally, this constitutes substandard care as it does not aim for a complete resolution of the problem, increasing the likelihood of treatment failure and potential harm to the patient. Another incorrect approach would be to aggressively attempt to remove all residual material without adequate control or appropriate instrumentation, leading to a perforation or instrument separation. Such procedural accidents compromise the integrity of the tooth and the success of the retreatment. This demonstrates a lack of skill and judgment, violating the dentist's duty to provide treatment in a manner that minimizes harm. A third incorrect approach would be to simply over-obturate on top of the existing material without attempting removal. This would create a layered obturation, potentially leading to voids and incomplete sealing, which can harbor bacteria and lead to reinfection. This approach neglects the critical step of thorough cleaning and shaping, which is essential for a successful endodontic outcome. Professional reasoning. Professionals faced with this situation should first assess the extent of the residual obturation material and its impact on canal access. They should then select the most appropriate instruments and techniques for its removal, prioritizing conservative measures to preserve tooth structure. Thorough irrigation and disinfection are paramount throughout the process. If complete removal proves exceptionally difficult or risks significant damage, the professional must weigh the benefits against the risks and consider alternative treatment options or referral. This decision-making process is guided by a commitment to patient well-being, adherence to established clinical protocols, and continuous professional development. Question 14. The control framework reveals a patient presenting with a firm, indurated exophytic lesion on the posterior buccal mucosa, measuring approximately 1.5 cm in diameter. The lesion has been present for several months and has not responded to conservative measures. The patient reports no significant pain, but notes a slight, intermittent bleeding upon mastication. Considering the lesion's characteristics and duration, which of the following biopsy techniques would be most appropriate for obtaining a definitive diagnosis? Option A, fine needle aspiration. Option B, exfoliative cytology. Option C, punch biopsy. Option D, wedge biopsy. The correct answer is D, wedge biopsy. Explanation. This scenario presents a common yet complex challenge in oral and maxillofacial surgery, specifically concerning the management of a potentially malignant lesion. The professional challenge lies in accurately diagnosing the lesion, determining the appropriate biopsy technique based on its characteristics and location, and ensuring patient safety and informed consent throughout the process. The dentist must balance the need for definitive diagnosis with minimizing patient morbidity and adhering to established surgical and ethical standards. The correct approach involves a thorough clinical examination, consideration of imaging if indicated, and selection of a biopsy technique that yields an adequate specimen for histopathological analysis while being minimally invasive and appropriate for the suspected lesion. This aligns with best professional practice by prioritizing accurate diagnosis, patient well-being, and evidence-based treatment. Adherence to the principles of informed consent, proper sterile technique, and appropriate specimen handling are paramount and are implicitly or explicitly governed by dental practice acts and ethical guidelines that mandate competent and responsible patient care. An incorrect approach would be to perform a superficial shave biopsy on a lesion suspected of being deeply invasive or malignant. This would fail to obtain a representative sample, potentially delaying diagnosis and appropriate treatment, which constitutes a failure to meet the standard of care and could be considered professional negligence. Another incorrect approach would be to proceed with a biopsy without obtaining informed consent, violating a fundamental ethical and legal requirement that patients have the right to understand the risks, benefits, and alternatives of any procedure. Performing a biopsy in a non-sterile environment or mishandling the specimen would also represent a failure to adhere to basic infection control protocols and proper laboratory submission procedures, compromising the integrity of the diagnostic process and potentially leading to misdiagnosis. The professional decision-making process for similar situations should begin with a comprehensive patient history and clinical examination. This should be followed by a differential diagnosis, considering the most likely etiologies. Based on the differential diagnosis and the characteristics of the lesion, size, depth, appearance, location, the dentist should then select the most appropriate diagnostic procedure, which may include imaging or a biopsy. If a biopsy is indicated, the technique should be chosen to maximize diagnostic yield while minimizing risk. Throughout this process, clear communication with the patient, including obtaining informed consent, is essential. Post-biopsy management and follow-up are also critical components of patient care. Question 15. Governance review demonstrates that a 78-year-old patient, Mr. Henderson, presents for a routine dental examination. He reports significant dry mouth and has multiple carious lesions on his root surfaces. He is taking 5 prescription medications for various chronic conditions. When discussing treatment options for his root caries, Mr. Henderson states, "Just fill them. I don't want to bother with all that other stuff." He appears somewhat disoriented when asked about his medication schedule. Which of the following approaches best addresses Mr. Henderson's oral health needs while respecting his autonomy and adhering to professional standards? Option A. Schedule a consultation with Mr. Henderson's physician to discuss his polypharmacy and its potential impact on his oral health, and postpone definitive restorative treatment until a comprehensive understanding of his medical status and capacity for informed consent is established. Option B. Proceed with restorative treatment for the root caries, provide a prescription for a saliva substitute, and document the patient's refusal of further discussion. Option C. Inform Mr. Henderson that his current oral hygiene and medication regimen are unacceptable and refuse to provide treatment until he agrees to a strict regimen of fluoride rinses and frequent brushing. Option D. Immediately refer Mr. Henderson to a prosthodontist for immediate denture fabrication, assuming his current dentition is unsalvageable due to his oral health status. The correct answer is B. Proceed with restorative treatment for the root caries, provide a prescription for a saliva substitute, and document the patient's refusal of further discussion. Explanation. This scenario presents a common ethical dilemma in geriatric dentistry, highlighting the tension between patient autonomy and the dentist's professional responsibility to provide appropriate care, especially when a patient's cognitive status may impact their decision-making. The challenge lies in balancing the patient's stated wishes with the dentist's obligation to prevent harm and promote oral health, particularly in the context of polypharmacy and its oral sequelae. The correct approach prioritizes a comprehensive assessment of the patient's capacity to make informed decisions, recognizing that age alone does not equate to incapacity. It involves a thorough medical history review, including a detailed understanding of the patient's medications and their potential oral side effects, such as xerostomia and increased root caries risk. This approach emphasizes clear, patient-centered communication, utilizing strategies to enhance understanding and ensure the patient's consent is truly informed. It also involves collaborative care with the patient's physician to manage systemic conditions and polypharmacy, thereby addressing the root causes of oral health issues. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy, all of which are foundational to dental practice under the regulatory framework governing the INBDE. An incorrect approach that proceeds with treatment without adequately assessing the patient's capacity for informed consent would violate the principle of autonomy and potentially lead to inappropriate treatment. Failing to investigate the underlying causes of xerostomia and root caries, such as polypharmacy, and instead solely focusing on symptomatic relief or restorative procedures, would be a failure of beneficence and professional competence. Similarly, ignoring the patient's expressed concerns or dismissing their input without a valid reason would be ethically unsound and could erode the patient-dentist relationship. A failure to communicate effectively with the patient or their caregiver, or to involve the patient's physician in managing systemic issues impacting oral health, would represent a breach of professional responsibility and could lead to suboptimal outcomes, potentially violating standards of care. The professional decision-making process in such situation should involve a systematic evaluation. First, assess the patient's capacity to understand their condition, the proposed treatment, alternatives, and risks/benefits. If capacity is questionable, involve a caregiver or family member with appropriate consent. Second, conduct a thorough medical and dental history, paying close attention to systemic diseases and polypharmacy. Third, develop a treatment plan that addresses the underlying causes of oral health problems, not just the symptoms. Fourth, communicate clearly and empathetically with the patient, adapting communication methods as needed. Finally, document all assessments, discussions, and treatment decisions meticulously. Question 16. The risk matrix shows a moderate risk of patient dissatisfaction if orthodontic treatment aims to significantly alter skeletal relationships using only fixed appliances in an adult patient with a class Roman II malocclusion characterized by a retrognathic mandible. The patient expresses a strong desire for a more prominent chin and a reduced overjet, with a secondary concern for tooth alignment. The dentist has completed a comprehensive diagnostic workup, including cephalometric analysis, which confirms a significant skeletal discrepancy. Which of the following diagnostic and treatment planning approaches best mitigates the identified risk and aligns with best professional practice for this INBDE-relevant scenario? Option A. Recommend a treatment plan solely focused on aligning the teeth with fixed appliances, emphasizing the aesthetic improvements achievable through tooth movement alone and downplaying the skeletal component of the malocclusion. Option B. Propose a comprehensive treatment plan that includes orthognathic surgery in conjunction with orthodontic preparation and retention, clearly explaining to the patient the necessity of surgical intervention for skeletal correction and the role of orthodontics in achieving optimal occlusion and aesthetics. Option C. Advise the patient that significant skeletal changes are not possible with orthodontic treatment alone and suggest that they accept their current facial profile, focusing only on minor tooth alignment adjustments. Option D. Proceed with a treatment plan using only fixed appliances, aiming to retract the maxillary anterior teeth to reduce the overjet, and inform the patient that this will improve their profile, without explicitly mentioning the limitations regarding mandibular position. The correct answer is B. Propose a comprehensive treatment plan that includes orthognathic surgery in conjunction with orthodontic preparation and retention, clearly explaining to the patient the necessity of surgical intervention for skeletal correction and the role of orthodontics in achieving optimal occlusion and aesthetics. Explanation. This scenario presents a professional challenge due to the inherent variability in orthodontic treatment outcomes and the potential for patient dissatisfaction if expectations are not managed appropriately. The dentist must balance the patient's aesthetic desires with the biological limitations of tooth movement and the long-term stability of the results. Careful judgment is required to ensure that the proposed treatment plan is both clinically sound and ethically presented. The correct approach represents best professional practice because it prioritizes informed consent and realistic treatment planning, aligning with the principles of patient autonomy and beneficence. By thoroughly explaining the limitations of fixed appliances in achieving significant skeletal changes and proposing a multidisciplinary approach, The dentist is acting in the patient's best interest, ensuring that the treatment is appropriate for the diagnosed malocclusion and maximizes the likelihood of a stable, functional, and aesthetically pleasing outcome. This adheres to the ethical obligation to provide competent care and to avoid unnecessary or ineffective treatment. An incorrect approach that focuses solely on patient preference without considering clinical feasibility would be ethically problematic. It could lead to patient dissatisfaction, potential relapse, and a failure to achieve optimal occlusal and skeletal relationships, thereby violating the duty of care. Another incorrect approach that overpromises results with fixed appliances alone, ignoring the skeletal component, would be misrepresentative and could lead to compromised outcomes and potential harm. This would be a failure of professional integrity and could be considered deceptive practice. A third incorrect approach that dismisses the patient's concerns without adequate explanation or alternative solutions would be a failure to communicate effectively and to respect the patient's autonomy in decision-making. The professional reasoning process should involve a comprehensive diagnosis, including a thorough clinical examination, radiographic assessment, and cephalometric analysis. Based on this diagnosis, the dentist should develop a treatment plan that addresses the underlying causes of the malocclusion and considers the patient's goals. Open and honest communication with the patient about the proposed treatment, its potential benefits, risks, limitations, and alternatives is crucial. This allows for shared decision-making and ensures that the patient's expectations are aligned with the realistic possibilities of orthodontic treatment. Question 17. The audit findings indicate a pattern of implant treatment plans that do not consistently account for the influence of existing fixed prostheses on optimal implant placement and subsequent prosthetic rehabilitation. In a patient presenting with a well-maintained but extensive anterior fixed bridge, what is the most appropriate initial step in treatment planning for potential implant placement in the edentulous posterior segments? Option A. Inform the patient that implant treatment is not feasible due to the presence of the extensive anterior bridge, and explore alternative restorative options. Option B. Conduct a comprehensive diagnostic workup, including CBCT imaging, to assess bone availability and the spatial relationship between potential implant positions and the existing anterior bridge, followed by a discussion with the patient regarding potential modifications to the bridge if necessary for ideal implant rehabilitation. Option C. Recommend the removal and replacement of the existing anterior bridge prior to any implant treatment, planning to ensure maximum flexibility in implant positioning. Option D. Proceed with implant placement in the edentulous areas, planning the prosthetics to emerge through or around the existing anterior bridge without further evaluation of the bridge's impact. Correct answer is D. Proceed with implant placement in the edentulous areas, planning the prosthetics to emerge through or around the existing anterior bridge without further evaluation of the bridge's impact. Explanation. Scenario analysis. This scenario presents a common challenge in implant dentistry, where a patient's existing restorative work may interfere with optimal implant placement and prosthetic rehabilitation. The dentist must balance the patient's desire for implant treatment with the need to achieve a predictable and functional outcome, considering the limitations imposed by the existing fixed prostheses. This requires a thorough understanding of implant biomechanics, restorative principles, and patient-specific factors. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the existing restorative framework and its potential impact on implant treatment. This involves detailed radiographic evaluation, including CBCT, to assess bone volume, density, and proximity to vital structures, as well as to visualize the existing restorations and their margins. Furthermore, it necessitates a discussion with the patient about the potential need for modification or replacement of existing restorations to facilitate ideal implant positioning and prosthetic emergence. This aligns with the INBDE emphasis on evidence-based practice and patient-centered care, ensuring that treatment plans are not only technically feasible, but also lead to long-term success and patient satisfaction, adhering to ethical principles of informed consent and avoiding unnecessary compromises. Incorrect approaches analysis. One incorrect approach involves proceeding with implant placement without adequately assessing the existing restoration's influence on ideal implant positioning. This could lead to compromised prosthetic outcomes, such as poor aesthetics, occlusal disharmony, or increased stress on the implant restoration complex, potentially resulting in premature implant failure. This violates the principle of providing competent care and could be considered negligent. Another incorrect approach is to assume that the existing restorations can be worked around without any modification. This overlooks the critical biomechanical considerations of implant placement and prosthetic design, which often require specific angulation and emergence profiles for optimal function and longevity. Failing to address these potential conflicts proactively can lead to complications and may not meet the standard of care expected in implant dentistry. A third incorrect approach is to dismiss the patient's desire for implant treatment solely due to the presence of existing restorations without a thorough evaluation. While patient desires must be balanced with clinical reality, a complete refusal without exploring all viable options, including potential modifications to existing work or alternative treatment strategies, may not be in the patient's best interest and could be seen as a failure to explore all reasonable treatment avenues. Professional reasoning. Professionals should approach such situations by first conducting a thorough diagnostic workup, including clinical examination and advanced imaging. This should be followed by a detailed discussion with the patient, outlining all potential treatment options, including the implications of existing restorations, the need for modifications, and the associated risks and benefits. The decision-making process should be guided by established clinical protocols, evidence-based literature, and a commitment to achieving the best possible functional and aesthetic outcome for the patient, while always prioritizing patient safety and informed consent. Question 18. Process analysis reveals that a patient presenting with a long history of diagnosed trigeminal neuralgia reports escalating pain despite current opioid therapy. The patient expresses significant distress and requests an increase in their opioid prescription. The dentist suspects potential opioid dependence alongside the chronic pain condition. Which of the following management strategies best aligns with current best practices and regulatory expectations for managing such a complex orofacial pain scenario within the INBDE jurisdictional framework? Option A. Focus solely on psychological interventions and dismiss the patient's reported pain as primarily psychosomatic, without further medical investigation or pharmacological adjustment. Option B. Initiate a structured tapering plan for opioid medication, while concurrently exploring non-pharmacological pain management techniques and considering adjunctive medications with a lower risk profile for dependence, coupled with a referral for substance use disorder evaluation. Option C. Immediately increase the opioid dosage to provide adequate pain relief, as the patient's subjective report of pain is the primary indicator of need. Option D. Discontinue all opioid medications abruptly to prevent further dependence, and advise the patient to seek pain management from other specialists without offering alternative treatment strategies. The correct answer is B. Initiate a structured tapering plan for opioid medication while concurrently exploring non-pharmacological pain management techniques and considering adjunctive medications with a lower risk profile for dependence, coupled with a referral for substance use disorder evaluation. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it involves managing a patient with chronic orofacial pain, specifically trigeminal neuralgia, who is exhibiting signs of opioid dependence. The dentist must balance the immediate need for pain relief with the long-term risks of addiction and the potential for exacerbating the underlying condition through inappropriate pharmacological management. This requires a nuanced understanding of pain assessment, pharmacological interventions, and the ethical considerations surrounding controlled substance prescribing. Correct approach analysis. The correct approach involves a comprehensive assessment that includes not only the intensity of the pain, but also its impact on the patient's quality of life, functional status, and psychological well-being. This assessment should also screen for substance use disorder. The management plan should prioritize non-pharmacological interventions and, if pharmacotherapy is necessary, utilize a multimodal approach that includes medications with a lower potential for dependence and abuse, alongside careful monitoring and regular reassessment. This aligns with the INBDE emphasis on evidence-based practice and patient-centered care, which necessitates a thorough understanding of pain mechanisms and appropriate treatment modalities for chronic pain conditions like trigeminal neuralgia. Ethical guidelines and state dental board regulations, consistent with U.S. federal controlled substance regulations, mandate responsible prescribing of controlled substances, requiring documentation of medical necessity, risk assessment, and patient education. Incorrect approach is analysis. One incorrect approach would be to solely increase the opioid dosage to manage the patient's reported pain. This fails to address the potential for opioid dependence and tolerance, which can lead to escalating doses without proportional pain relief, increasing the risk of adverse events and addiction. Ethically and regulatorily, this constitutes a failure to adhere to responsible prescribing practices for controlled substances, potentially violating state and federal laws that require careful consideration of non-opioid alternatives and a comprehensive pain management plan. Another incorrect approach would be to abruptly discontinue all opioid therapy without a structured detoxification plan or alternative pain management strategies. This could lead to severe withdrawal symptoms, significant patient distress, and a breakdown in the patient-dentist relationship. It also fails to address the underlying chronic pain condition and the patient's legitimate need for pain management, potentially leading the patient to seek illicit substances. This approach neglects the ethical obligation to provide humane care and manage pain effectively, and it may violate professional standards for managing patients with substance use disorders. A third incorrect approach would be to dismiss the patient's pain as purely psychological without a thorough medical and neurological evaluation. While psychological factors can influence pain perception, trigeminal neuralgia is a distinct neurological condition. Failing to acknowledge the organic basis of the pain and solely attributing it to psychological causes is a diagnostic and therapeutic failure. It also neglects the dentist's responsibility to manage orofacial pain within their scope of practice and to refer appropriately when necessary, potentially violating ethical standards of care and professional competence. Professional reasoning. Professionals should approach such cases by first conducting a thorough, multidimensional pain assessment. This includes evaluating pain characteristics, functional limitations, psychological factors, and a detailed history of substance use. Next, they should develop a treatment plan that prioritizes non-pharmacological interventions and multimodal pharmacotherapy, considering medications with lower abuse potential. For chronic pain, especially with suspected opioid dependence, a collaborative approach involving pain management specialists or addiction medicine professionals may be indicated. Regular reassessment, clear communication with the patient about treatment goals and risks, and meticulous documentation are paramount. Adherence to state and federal regulations regarding controlled substances, including prescription drug monitoring program checks and appropriate prescribing limits, is non-negotiable. Question 19. Stakeholder feedback indicates that some patients feel their preferences are not fully considered when a dentist recommends a different treatment than what they initially requested. A patient presents with a desire for a specific cosmetic dental procedure that, in your professional judgment, is not indicated due to potential long-term complications and the availability of a more conservative, equally effective alternative. The patient expresses strong conviction about their desired procedure. What is the most appropriate course of action? Option A. Inform the patient that their requested procedure is not suitable and refuse to perform it without further discussion or exploration of alternatives. Option B. Thoroughly explain the risks and potential complications of the requested procedure, discuss the benefits and limitations of the recommended alternative, and collaboratively determine the best treatment plan with the patient, ensuring they understand all options. Option C. Proceed with the patient's requested procedure as they are insistent, as patient autonomy is paramount and the dentist should fulfill their wishes. Option D. Recommend the alternative treatment and document that the patient was informed of the risks of their requested procedure, but do not engage in further discussion about their initial preference. The correct answer is B. Thoroughly explain the risks and potential complications of the requested procedure, discuss the benefits and limitations of the recommended alternative, and collaboratively determine the best treatment plan with the patient, ensuring they understand all options. Explanation. This scenario presents a professional challenge due to the conflict between a patient's expressed desire for a specific treatment and the dentist's professional judgment regarding its appropriateness and potential harm. The dentist must navigate the ethical principles of patient autonomy, beneficence, and non-maleficence, while also adhering to legal requirements for informed consent and professional standards of care, as defined by the Integrated National Board Dental Examination (INBDE) framework, which implicitly aligns with U.S. dental practice regulations. The correct approach prioritizes patient well-being and professional integrity. It involves a thorough and empathetic communication process where the dentist explains the risks and benefits of the requested treatment, explores alternative, more appropriate options, and educates the patient on the rationale behind their professional recommendation. This approach upholds the principle of beneficence by acting in the patient's best interest and non-maleficence, by avoiding potentially harmful or unnecessary procedures. It also respects patient autonomy by providing comprehensive information for an informed decision, even if that decision ultimately differs from the patient's initial request. This aligns with the ethical guidelines for professional conduct and the legal requirements for informed consent, which mandate that patients receive sufficient information to make a voluntary and informed choice about their treatment. An incorrect approach would be to proceed with the patient's requested treatment without adequate discussion or exploration of alternatives, even if the patient insists. This would violate the principle of non-maleficence, as the dentist would be performing a procedure they believe to be inappropriate or potentially harmful, thereby failing to act in the patient's best interest. This also constitutes a failure in informed consent, as the patient would not have been fully apprised of the risks, benefits, and alternatives from a professional perspective. Another incorrect approach would be to dismiss the patient's concerns or desires outright without attempting to understand their motivations or provide clear, empathetic explanations. This demonstrates a lack of professionalism and poor communication skills, potentially damaging the patient-dentist relationship and failing to uphold the ethical duty of respect for the patient. Furthermore, failing to document the discussion thoroughly would be a legal and ethical lapse, leaving the dentist vulnerable and failing to provide a clear record of the decision-making process. The professional decision-making process in such situations should involve 1. Active listening and empathy to understand the patient's perspective and underlying concerns. 2. Clear and understandable communication of professional assessment, including risks, benefits, and alternatives. 3. Collaborative decision-making, aiming for a mutually agreeable treatment plan that aligns with professional standards and patient values. 4. Thorough documentation of the entire process, including discussions, patient understanding, and the final treatment plan. Question 20. The performance metrics show a high rate of patient satisfaction with aesthetic outcomes in your practice. A patient presents with a deep carious lesion on the facial surface of a maxillary premolar, extending close to the pulp. The patient expresses a strong desire for a composite resin restoration due to its immediate aesthetic appeal and minimal tooth reduction compared to an indirect restoration. You are concerned about the long-term predictability and potential for pulpal complications with a direct composite in such a deep preparation. What is the most appropriate course of action? Option A. Place a direct composite resin restoration and recommend immediate referral to an endodontist for prophylactic root canal therapy to prevent future pulpal issues. Option B. Thoroughly discuss the risks and benefits of both direct composite resin and indirect restoration options, including potential pulpal irritation, secondary caries, and longevity, ensuring the patient understands the implications of their choice before proceeding with a mutually agreed-upon plan. Option C. Proceed with the direct composite resin restoration as requested by the patient, prioritizing their aesthetic preference and minimizing tooth reduction without extensive discussion of potential risks. Option D. Insist on an indirect restoration, such as a ceramic crown, as the only acceptable treatment for this deep carious lesion, disregarding the patient's preference for a composite resin. The correct answer is B. Thoroughly discuss the risks and benefits of both direct composite resin and indirect restoration options, including potential pulpal irritation, secondary caries, and longevity, ensuring the patient understands the implications of their choice before proceeding with a mutually agreed-upon plan. Explanation. Scenario analysis. This scenario presents an ethical dilemma involving patient autonomy, informed consent, and the dentist's professional judgment regarding treatment options for a deep carious lesion. The patient's expressed preference for a less invasive, aesthetic option. Composite resin conflicts with the dentist's assessment that a more definitive treatment, indirect restoration, might be indicated for long-term success and to prevent further complications. The challenge lies in balancing the patient's desires with the dentist's responsibility to provide the best possible care, adhering to ethical principles and professional standards. Correct approach analysis. The correct approach involves a thorough discussion with the patient, clearly explaining the risks and benefits of both direct composite resin and indirect restoration options for the deep carious lesion. This includes detailing the potential for pulpal irritation, secondary caries, and the longevity of each restoration type given the depth of the caries. The dentist must ensure the patient fully understands the implications of their choice, particularly if they opt for the composite resin despite the increased risk. This aligns with the ethical principle of patient autonomy and the requirement for informed consent, as mandated by dental practice acts and professional ethical codes that emphasize patient-centered care and shared decision-making. The dentist must document this discussion and the patient's informed decision. Incorrect approach is analysis, choosing to proceed solely with the direct composite resin restoration without a comprehensive discussion of risks and alternatives, or without adequately assessing the pulpal status, would be professionally unacceptable. This approach disregards the dentist's duty to provide the most appropriate care and could lead to treatment failure, requiring more complex and costly interventions later. Ethically, it violates the principle of beneficence and potentially non-maleficence, as it prioritizes patient preference over optimal clinical judgment without adequate justification or informed consent. It also fails to meet the standards of care for managing deep caries, which often necessitates a more conservative approach to protect the pulp. Refusing to consider the patient's preference for a composite resin and insisting solely on an indirect restoration without exploring the feasibility or potential compromises of a direct restoration would also be professionally problematic. While the dentist's concern for longevity is valid, rigidly adhering to one treatment plan without considering patient input or exploring all viable options can undermine the patient-dentist relationship and the principle of shared decision-making. This approach may not fully respect patient autonomy if the patient has valid reasons for their preference, and if a direct composite could be reasonably managed with appropriate techniques. Failing to adequately document the discussion, the patient's decision, and the rationale for the chosen treatment plan is a significant ethical and regulatory failure. Proper documentation is crucial for protecting both the patient and the practitioner, serving as a record of informed consent and the clinical reasoning employed. Without it, it becomes difficult to defend the treatment provided if complications arise. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive clinical assessment, including radiographic evaluation and pulp vitality testing. Following this, a transparent and empathetic communication with the patient is paramount. The dentist should present all viable treatment options, explaining their respective advantages, disadvantages, risks, benefits, and prognoses in clear, understandable language. The patient's values, preferences, and concerns should be actively solicited and considered. The decision-making process should be collaborative, leading to a mutually agreed-upon treatment plan that is both clinically sound and respects the patient's autonomy. Thorough documentation of this entire process is essential.